When it comes to chronic pain, muscle and joint pain are two of the most common issues people experience. Unfortunately, the exact cause of muscle and joint pain varies greatly. It can be due to injuries, illnesses, or medical conditions. Furthermore, everyday activities such as sitting in a chair for long periods of time can also cause muscle and joint pain. With the sheer amount of potential causes, it can be quite overwhelming to try and determine what is causing your particular pain. This video will explore the various factors that can cause muscle and joint pain, in order to help you better understand your own pain. We'll cover items such as the types of injuries that can cause muscle and joint pain, medical conditions and illnesses, and repetitive activities. Additionally, we'll provide tips and advice on how to manage and reduce muscle and joint pain. By the end, you'll have a better understanding of what is causing your muscle and joint pain and how to reduce your pain. 1. Overuse of muscles. Overuse of muscles is one of the most prevalent causes of muscle and joint pain. This type of discomfort can be the result of repetitive actions, such as lifting heavy objects, running, or engaging in physical activities. It can also be caused by remaining in an uncomfortable or awkward position for an extended period, such as sitting at a desk for prolonged periods of time. Muscle and joint pain from overuse can be minor to severe and can range from a dull ache to a sharp pain that limits mobility. To help prevent this type of discomfort, it is recommended to take frequent breaks to stretch and move when engaging in activities that involve repetitive motions. Additionally, it is important to take the time to adjust the body's posture throughout the day. 2. Lack of physical activity. One of the key reasons for muscle and joint pain is an insufficient level of physical activity. When your body is not adequately exercised, your muscles and joints are not given the chance to build necessary strength and flexibility. This lack of strength and flexibility can result in muscle strain, joint misalignment, and other issues. All of these can cause discomfort and pain in the muscles and joints. In order to prevent this type of pain, it is important to have a regular exercise regimen that focuses on strength and flexibility. Strength training not only helps to increase muscle mass and prevent muscle strain, but it also helps to improve joint alignment and overall stability. This can reduce the risk of joint pain and discomfort. Additionally, incorporating flexibility exercises into 3. Osteoarthritis. Osteoarthritis is a very common cause of muscle and joint pain, but it can also affect other parts of the body. It is a degenerative joint disease that causes the cartilage, bones, and tissues in the joints to wear down over time. This often leads to joint pain, stiffness, and limited movement. Osteoarthritis is most commonly seen in people who are older, as the wear and tear of age can cause the cartilage to deteriorate faster. It can also be seen in people with a family history of the condition and those who have had a previous joint injury. In some cases, obesity or overuse of the joint can also increase the risk of developing osteoarthritis. 4. Stress. Stress is a significant cause of muscle and joint pain. Stress can cause physical tension in our bodies, which can lead to tightness in the muscles and increased pressure on our joints. When we are feeling overwhelmed, this tension can build up in our muscles and joints, resulting in pain. Stress can also have a negative effect on our immune system, making us more vulnerable to inflammation and pain. To reduce the amount of stress in our lives, it is important to take time for ourselves to relax and practice self-care. 5. Injury. Injuries are another common cause of muscle and joint pain. These injuries can range from mild to severe and can include overuse injuries, such as tendinitis or bursitis, as well as acute injuries, such as sprains, strains, and fractures. Minor injuries can often be treated at home with rest, ice, a compression bandage, and over-the-counter anti-inflammatory medications like ibuprofen or naproxen. More serious injuries may require medical attention, and may require physical therapy, medications, or even surgery. It is important to note that muscle and joint pain can also be due to systemic conditions such as an autoimmune disease or arthritis, and should always be discussed with a doctor if pain persists. 6. Diseases. Muscle and joint pain can be caused by a number of diseases, some of which can be very serious. These include arthritis, fibromyalgia, Lyme disease, tendinitis, bursitis, multiple sclerosis, and lupus. Arthritis is an inflammation of the joints that causes pain, swelling, and stiffness, while fibromyalgia is a condition that causes chronic muscle and joint pain, fatigue, and even depression. Lyme disease, a bacterial infection spread by ticks, can also cause muscle and joint pain as well as a rash and flu-like symptoms. Tendinitis is an inflammation of the tendons, which connect muscle to bone, and bursitis is an inflammation of the fluid-filled sacs that act. 7. Autoimmune conditions. Autoimmune conditions are a common cause of muscle and joint pain, but they can also cause fatigue, fever, and rashes. These are complex conditions in which the body's immune system mistakenly attacks its own cells, leading to inflammation and pain. Examples of autoimmune conditions include rheumatoid arthritis, lupus, and fibromyalgia. Symptoms of autoimmune disorders vary, but can include joint pain, fatigue, fever, and skin rashes. Treatment for autoimmune disorders often includes medications and lifestyle changes to reduce inflammation and reduce symptoms. In some cases, biological therapies may be used to target the immune system and reduce inflammation. It is important to talk to your doctor if you think you may have an autoimmune disorder, as early diagnosis. 8. Poor posture. Poor posture is one of the leading causes of muscle and joint pain. Poor posture leads to muscle imbalances. When the body is not in its natural alignment, muscles become overworked or underworked. When this happens, it can cause pain, tension, and fatigue. Some common forms of poor posture include slouching, hunching, and leaning. These postures put strain on the spine, shoulders, neck, and hips, which can lead to aches, pains, and discomfort. It can even worsen existing medical conditions, such as scoliosis or herniated discs. To prevent or reduce pain and tension, it's important to practice good posture habits, such as sitting up straight and keeping your head aligned with. In conclusion, muscle and joint pain may be caused by a variety of factors, including overuse, injury, and medical conditions. There are a variety of treatments available for muscle and joint pain, such as physical therapy, medications, and lifestyle changes. It is important to talk to a healthcare professional to determine the best treatment plan and to ensure the underlying cause is addressed.